Welcome to this training video. Starting June 16th, there will be a new process for admission medication reconciliation that begins with the emergency room nurse and physician. The emergency room physician will no longer be reconciling the outpatient medications on paper. They will be doing a CPOE process of reconciling and ordering the essential medications for the admitted patient. The patient arrives on the unit from the ED. The nurse opens the patient profile. The nurse verifies the outpatient med list with the patient. If the outpatient med list is complete and accurate, then save as complete. If, however, there is a medication that needs to be clarified, example, little red pill, then save the med list as incomplete, just as you do now. Refresh and check. The nurse will now launch Order Reconciliation to view which medications the ER physician has deemed essential and ordered for inpatient medications. It opens to the Reconcile Orders tab. The nurse selects Admission. Looking at the home medication list, the nurse uses critical thinking to see if there are any essential meds that the patient will need before the initial visit by the attending physician. If no essential medications are noted, the nurse closes the document. If, however, an essential medication is noted that needs to be reconciled, the nurse places a call to the attending physician. Example, Pradaxa, Ambien, Lipitor. The attending physician calls to reconcile the medication. The nurse returns to the patient profile and opens the outpatient medication section and launches the reconciliation document. The nurse chooses the physician and the appropriate source. The nurse uses the black action down arrow to pull over or continue the medication to be reconciled as per the physician's order. Should the physician elect to not continue a home medication for inpatient use, the nurse will choose the black action down arrow and choose the Do Not Continue as Inpatient order. Selecting this action will flag the home medication as reconciled, but does not remove it from the outpatient medication list. Note, you will now see verbiage under the medication name that states, Do Not Continue as Inpatient order. The physician might choose to also give you an additional ancillary order, example, diet order, at the same time you are calling about the medication. The nurse can use the order entry icon to add the diet order. Remember, you still must write these orders on the physician order sheet if that is your process. The nurse saves the document as incomplete. The medication will now be on the Orders tab as an ordered med. If you are on a unit that is currently using physician order sheets, then you will continue to write your telephone orders. If you are on a unit that does not write orders on the physician order sheet, then you will reconcile the medication directly in ORM with a second nurse acknowledging your order. Once the medication is on the Orders tab, the secretary or RN will make any adjustments to the medication just as she does now. Example, a change in the administration time to stat or now. Thank you for your attention.